Good morning, Tobago. Good morning, members of the media. Thank you for joining me for this very early morning press briefing. I will let you know that we had executive council yesterday. Traditionally, we have it on a Wednesday, but we had executive council yesterday afternoon, late into the evening, and that's because when I am through with this press briefing, I head to the airport and to Trinidad to have a meeting with the Ministry of Finance. And so I felt before I do that, we should have this press briefing. Let me also say to the media, because I know many of you have been calling, trying to get on to me and so on. Let me indicate at this juncture, apologies that we have not always connected. However, you would appreciate that 14 days after a THA election, we are quite busy trying to pull everything together, get everyone in line, and ensure that we are at a place whereby we can ascertain what we have, we can ascertain what is required, and our respective secretaries and assistant secretaries and advisors are more or less ensuring that they are getting to know the job, which I think is critical in this period and critical for going forward, since we intend to begin January with a blast, so to speak. There are a few issues that I wish to address with you that I feel are important. And in fact, I wish to start with the issue of finance. And I've heard during the week, ending of last week into this week, some responses from the minority, and there are several bits of misinformation that requires some correcting. So, I wish to start there. I heard somewhere along the line the former Secretary of Finance indicating that there is some $344 million that he left available for the THA. Let me say now that yes, there was $344 million. However, that is not available for us. In fact, that is not available for future utilization by the THA. Those are actually committed funds. In other words, those are committed to unpresented checks. And let me break this down into layman terms. If you have a checking account and you issue checks to service providers and you issue checks to various individuals, then you better be sure that your account has enough money to clear those checks whenever those individuals decide to cash their checks or whenever they decide to pick up their checks. And so that $344 million, when we look at checks to be cashed and checks to be collected, that is accounted for with the $344 million. So in other words, the former secretary and his team spent that money. So that cannot be used for future utilization by the Tobago House of Assembly. The second issue I wish to clear up immediately is the issue that he indicated that when he left on paper, there was between $75 million and $80 million in unspent balances. Well, I am not reporting on what is happening on paper. I'm reporting on the cash reality in our accounts. And the cash reality in our accounts is that unspent balances stand at $50 million, a little over $50 million. And even if that vary in the coming days, it won't vary by much. And so there is no 75 to 80 million in unspent balances. That is in essence just around $50 million. Remember, I'm the Secretary of Finance now. And remember, the public officers will on a daily basis report to me on what our balances actually are. So when I report to you, the public, I am not just pulling a number out of a hat or pulling a number from on a paper that I had somewhere a long time ago. I am pulling the figures directly from the public officers who have access to our account around $50 million in unspent that they have spent out in under 6 months. And that's because I guess they can't come up with a great untruth to tell where that is concerned. With regards to the contingency fund, I wish to remind and insist that that only stands at $392,000. That is the actual balance that we have for this fiscal year. What is instructive to note is that at the beginning of fiscal 2021, and fiscal 2021 would start in started in October of 2020, because you know our fiscal year runs between October in one year and September in the other year. So at the start of fiscal 2021, we had $3.9 million, and we had as unspent transfers 147.1 million. We spent 150.5 million. So let me go out again. At the start of fiscal 2021, we had 3.9 million in the contingency fund, and we had in unspent transfers, we had 147.1 million, and we spent 150.5 million. And so at the beginning of fiscal 2022, which started in October this year, we are only at $392,000. Those are the facts. Let me add two other bits of information. One, I am seeing this notion that, look, yes, we might have spent out all our savings, but we expect monies to come from central government. Now, let me tell you what is dangerous about that argument. Savings are what we use for emergencies. I already pointed out that what the central government gives us in allocations is are not enough. What we get, the monies we get are not enough to fund the THA fully. I've already pointed that out. And so I gave the example of URP, allocation $18 million. We have already received and spent that entire $18 million. So it means then we have to rely on our savings to pay URP workers for the rest of the year. And so it is in many areas, because if you look at every budget passed, you realize that we have been asking for $4 billion and so on, but we never receive anywhere close to that. It means, therefore, that we will never proportioned or given sufficient funding as we need to run the entire Tobago House of Assembly. So savings will always have to kick in to augment what we receive from Trinidad. Now that we have spent all that we received so far for URP and have to find monies to pay URP for the rest of fiscal year 2022, we will have to be vying monies from other places to do that. Why? Because our unspent balances as of now is just over $50 million, and in the contingency fund as of now, the beginning of fiscal 2022 is $392,000. And so it doesn't matter what is to come from Trinidad. What is to come from Trinidad, none of that is budgeted for URP, as an example. Let me give you another area of concern. Your savings are also to treat with emergencies, just as your household. The monies you save, you use them for medical emergencies, maybe something pop up you did not account for in your monthly budget, and so you can pull from your savings to treat with those matters. Guess what? If the THA at the moment only has as contingency fund $392,000, and in cash reality, unspent balances of just over $50 million, it means, therefore, we cannot afford many emergencies. And we live on a small island. We live in the Caribbean. We live in an area that is most susceptible to the effects of climate change. What if there is a dangerous earthquake? What if towards the end of fiscal 2022, we end up with a hurricane? How do we respond to these things? And that's why the place we are in is a dangerous place. And the final thing I'll tell you on this is that next week I'm going to bring public officers to speak to you on this matter, because you hearing it from the political directorate, you could easily think that this is just political gimmicks and the fact that I am trying to posture in a particular political manner. So I'm going to bring the public officers to tell you in reality what we have. I've already asked them and they have completed it. I've asked them to prepare a document showing patterns of spending and our financial health at the moment from our significant accounts, and that will be made public. That entire document will be made public, and that's a first for the THA. We are laying all of our account information public and bare. The reason why I'm not sharing that with you today, as I said, I'm heading off to Trinidad to meet with the Ministry of Finance, and in that meeting, I would prefer to share a lot more of these details before I share it with the general public at large. So that was issue number one. Issue number two. Just allow me to just have some water, please. Issue number two, the matter of the Attorney General versus the people of Tobago. And in passing yesterday, I heard some misrepresentations that were being peddled by the Attorney General. A procedural hearing happened 2 days ago? On Monday. A procedural hearing happened on Monday. And let me inform the public of who will be representing the Tobago House of Assembly in this matter. Now, at the procedural hearing, we had 3 sets of attorneys represented on behalf of the THA, the Office of the Chief Secretary, and that of the Deputy Chief Secretary. The Deputy Chief Secretary, Mr. Watson Duke, brought into the case on an amicus basis, which is Latin for really friend of the court. He brought in, on that basis, former Attorney General, Mr. Ram Logan. The Tobago House of Assembly, which covers the other elements in the case, we have representing us, on one hand, Mr. Ramesh Maraj, Senior Counsel, and Mr. John Jeremy, Senior Counsel. And on that said day, on Monday, Mr. Maraj's wife died. And so Mr. Maraj delegated the responsibility to his junior, Mr. Kyle Taklal Singh. What will happen is that on the 5th of January, the hearing begins in full, with arguments being placed before the court and affidavits, responsive affidavits from the Tobago House of Assembly will be placed on the court records on that day, January the 5th. So what is developing in this case is a case where the people of Tobago will be represented more or less by 3 former attorney generals, all going against the current attorney general. And that's because we have a strong belief that this is a waste of the court's time and another attempt by the attorney general and his party in Trinidad to disrupt and to disregard the autonomous nature of the Tobago House of Assembly. You see, they can't win an election in Tobago, but they want to run Tobago from Port of Spain. And as your Chief Secretary, I will never ever allow that to happen. So that will not happen under my watch. And so essentially, we have 3 former attorney generals standing in the gap on behalf of the people of Tobago. And that's by way of update. I won't say any more on that case because it is a case that is active before the courts. The third area is the Prime Minister's edict about what will happen with unvaccinated public servants or workers of the government come the mid of January. Currently, we are assessing the situation and what are the implications for Tobago. The Prime Minister's own statistics says that 50% of TRHA is unvaccinated. And I want you to understand what this means. If we say to the unvaccinated TRHA workers, don't come to work, you won't get paid, you won't be laid off, you're still part of the establishment, just don't come to work. You can expect to go to the hospital and only meet 50% of the staff there. That is a recipe for disaster. It means we will get more dead people than we are getting right now. And I don't think that is even practical as far as Tobago is concerned. From a cursory assessment, it would appear that if we go this route, that the very vaccinated who will be showing up to work will not get paid, because we won't have enough people to process salaries. We won't have enough people for the functioning of the Tobago House of Assembly. And so before the executive of the THA makes a determination on what we will do with our staff, because we have no control over the staff that is paid by the central government. That will be police and fires and air traffic control. Those are under the remit of the central government and not the THA. The THA does not pay those categories of workers. But before we make a final determination on what we will do with our workers that we pay, I have asked the chief administrator, and she has sent a circular out to all departments of the THA asking to get an assessment of the vaccinated versus the unvaccinated. And that will help us determine the route we will take, because we cannot have a situation where the cost of the candle is more than the cost of the funeral. And so we are treading the situation cautiously, notwithstanding the fact that there were no consultations with anybody. No one from the central government reached out to us before they made their edict, so that we could have given them an assessment beforehand of what our staffing situation vis-a-vis those who are vaccinated versus those who are unvaccinated is. Notwithstanding that, I wish to take this platform to give a very strong signal to Tobagonians that we have to do better when it comes to this COVID situation. I can tell you that a 20-foot container is being prepared to be installed at the hospital, and that will be installed between Friday and over the weekend. And that will be installed to hold up to 45 dead bodies. Why are we doing that? The morgue is full. We're still trying to squeeze up dead in one tray. If you're fat, then you alone have to hold in a tray. And excuse me and allow me to sound crass now, because you need to get the reality of the situation. We have more dead than we can hold at the morgue, which means that far too many of our people are dying from this disease. In addition to which, the scale of infections on the island is actually affecting our ability to deliver health care for other areas. Our diabetics, our hypertensive patients, those with heart-related diseases, cancers, all are suffering from simple procedures. We have surgeries on hold. And I'm saying to you that whether you choose to get vaccinated or not, if you choose to be irresponsible, what will happen is that you can possibly end up dead. I want to say to those who are vaccinated like myself, being vaccinated is not an excuse to be careless. Being vaccinated doesn't mean that you should show up in every private zest. It doesn't mean that you should hold private zest. And we are about to get into the Christmas period. And I'm begging you, keep your celebrations to the family within your household. Please, don't keep no large parties. Try to contain your celebrations to within your household. Ensure that within your household, You have your family there, the family that you sleep with in the same house. Do your best. Make the Christmas bright and merry within your household. Have fun. Play games. Laugh. Watch movies together. Watch some Hallmark. But please, I beg of you, protect yourself. Protect yourself. There is so much that the state can do and no more. You do not protect yourself, then we will end up in problems. And let me say this, not only is our morgue full, but when you look down at what's happening in our public cemeteries in and around Scarborough area, Boko and Bacolet in particular, we have to start looking for space, for new land to bury people. The Tobago, I know, sees funeral and the burial of loved ones as something that is extremely sacred. Something that, we always want to celebrate the life of a loved one. And we celebrate in a particular way. And what's happening is that we have people dying of COVID and the family at home under quarantine, and they're begging because they don't want to bury the dead because they can't come to the funeral, and they want to wait until they come out of quarantine to bury the dead and so on. All of that is leading to a backup. And I need to say, please, family members, be considerate. You are to bury your dead as quickly as possible. Be considerate. Let me also extend an apology to that family. To that family who had a mix-up with the body. I was told by the Secretary of Health, Dr. B. Israel, that the matter has been sorted out. They received their correct body and they were able to do their burial. The Secretary of Health has been in constant conversation with the family, but I want from this platform to further extend apologies to that family for the mix-up. And listen, this kind of mix-up happening because the staff tired, staff burnt out, staff just missing things, simple things, and you can't blame the staff members. They have been going at this for a long, long time. They are tired. I went up to the hospital unannounced last week, and every staff member I spoke to talking about how tired they are. Imagine a nurse said to me, she said, sir, yes, we know all the owing, but the money is not the problem. The problem is that we're just tired. We're burnt out, and we feel like nobody is grateful for the work that we're doing. Please, Tobago, let me say to you again, if nothing else should appeal to you, should be the fact that we are having so many dead bodies that we just can't dispose of quickly. Let that appeal to you. You do not be the next one. Protect yourself. Wear your mask. Keep your social distance. No, it's not the time to lie on the block. No, it's not the time to just sit down drinking all over the place. Come on. What happened to all your house? All your house are courage. Spend some time at home. Take the opportunity to spend some time with your family. Go to work. Do the essential that is required. And get home. And spend the time productively with your family. Plant a little garden outside. Help the children with their lessons. Spend some time reading with your children. Sit down with your families. Men folk especially. Now is a good time to repair damages within your family. Now is a good time to build out your family. Let's use this crisis as an opportunity to develop our families more. And I hope that over the coming days I could appeal to you more, that the executive can appeal to you more, so that you will do better in terms of how you manage yourself during this crisis. And so yes, while I will be the first to explain to you the detrimental implications for sending home 50% and more than 50% in some cases of our staff because of being unvaccinated, and what that will do in crashing the system. And while I'll be the first to say that no one consulted with us, I will also be the first to remind you that you have to protect yourself. You have to protect yourself. Please protect yourself. And finally, I want to wish everyone a Merry Christmas and the happiest of New Year's. I want you to enjoy the season. I want you to keep praying for this island. I want to continue to urge you to share with your neighbors, help each other out the good old-fashioned Tobago way. I want to urge you in this season to spend some time to reflect on what 2021 was and to reflect on what you want 2022 to be. I want to thank you, the public, again for espousing confidence in this team to take us through these crises, whether it be financial, the COVID-19 pandemic, or otherwise. And at this juncture, I will open up for some questions. Let me say up front, if you could keep the questions snappy, that will be excellent. I'll try to keep the responses as short as possible because it's 9:38 a.m. and I have to catch a flight. I will not miss that meeting with the Ministry of Finance because I think it is important going forward. I believe we first have Miss Jackson. So, Miss Jackson, good day.
Good morning, Chief Secretary.
Good morning.
My question for you is, can you give me an idea of the agenda for the meeting with the Minister of Finance? What do you have? What is this meeting going to be about?
Okay, sure. I will tell you the agenda. We will be talking with the Ministry of Finance about our month-to-month releases as opposed to what the law dictates, which is quarterly releases. We'll be talking to the Ministry of Finance about the costs associated with the use of the overdraft facility that we have at the moment and how the interest, the enormous interest, isn't catered for in our budget allocation. And so that in itself is a recurrent expenditure that is bleeding us. We'll be talking to them about the THA representatives on state boards associated with the Ministry of Finance. We will also inquire about the status of the property tax matter and the starting up of the Revenue Authority and the unique Tobago situation. We will also be discussing the THA bond financing, the status of that and the way forward. And of course, the fact that his colleagues here in Tobago carelessly, recklessly spend out and waste out the money on things that weren't even aligned to the priorities that the Minister of Finance was informed of prior to the receiving of that bond financing. And of course, we wish to establish very important in my office here. Next question we have, I'm not seeing any other hands up, any other hands being raised on our virtual platform, or I'm seeing someone by the name of Zoom user. I'm not sure who that is, or Mr. Leacock. So Mr. Leacock, good morning.
Good morning. Zoom user works for me fine. I'm trying to understand a little bit about the process of this transitioning.
Mm-hmm.
Because you are saying that you're going to bring public officers in a couple of weeks to talk about these things and so on. Some of the things appear to be serious procedure, the ones that you're going to bring next week to tell us about about what the violations were.
Well, I don't know if we can directly blame public officers for the violations of procedure that I spoke about. Remember, public officers, all they do is execute, and they follow, by and large, instructions from the policymakers, from the executive. All I will be asking them to do is to share with you what is the status of our accounts. Because I feel as though, me just sharing it is insufficient, and that there will be a need without me even being present, for public officers to come and have that candid conversation about what is the state of our finances. I don't see a legal issue there at all.
But should they really be guided by the financial regulations and not necessarily instructions from assemblymen? And I have two other questions unrelated.
Well, I can tell you that now that I am here, they are certainly guided by financial instructions and not the instructions of assemblymen. In fact, the instructions of assemblymen have to align themselves to the financial regulations. So that is certainly happening at this time.
All right. Yesterday, after there was a video that was posted by somebody of a crayfish and other sea life die off on the Great Colon River, which really starts in Mason Hall, really starts maybe as high up as the main ridge, and obviously would affect the water intake at Colon, which WASA has closed. Have you been in contact with anybody? Is there updates of water samples being taken down to the laboratory to be tested and all that kind of thing? Because we can run into a terrible situation if we have Southwest Tobago, particularly where whatever little tourism we have is closed over the weekend as a result of there not being water.
Yes, and I can tell you that Mr. Pollard, Ian Pollard, on behalf of the executive, has reached out to and has been in communication with several agencies who, since that has occurred, they have already been on site. They have been taking water samples. They have been taking dead organisms for testing, and that includes WASA, it includes EMA, and other environmental agencies. So the assessment is being done as we speak. Hopefully, by sometime tomorrow, we will have a report that we can say almost definitively what has occurred in that matter. But you are correct, it's a matter of grave concern for us. And so we did reach out through Mr. Pollard, and the necessary assessments are being done.
All right, and the final question. In response to the Secretary for Health's call for assistance, I have been contacted by, surprising, medical practitioners who have Trinidad and Tobago roots who want to assist. However, we've been told that, as medical doctors, they have to be board certified or something like that to allow them to practice in Trinidad and Tobago. There are actually some people who are already physically here, and they are being told that the offices will not open until the 4th of January, so that it's not possible for them to have that kind of registration take place before then, which would allow them to try to have some impact on the process, to offer the assistance that the Secretary for Health is asking about. Is this something that has come to your attention before? And if it's only coming to your attention now, is there an avenue that you can maybe jump on to allow for some what must be emergency action? And can I lean on you a little to ask for a tiny bit of an update in terms of what's happening with the hospital, with the emergency actions that you have had to take?
Yes, so this is only now coming to my attention, and certainly is a matter that we will have to stage an intervention for. And we will have to get onto the medical board to see what can be done in an emergency situation like this to be able to facilitate what is required. Because you're right, people are coming forward, willing to volunteer their services. They are here in the country. They're willing to give and give freely. And given the fact that we have been saying that, we are understaffed, under-resourced, especially with human capital at the hospital, that, that there is an urgent need to augment what we have there, to add to our resource bank there. this is something that we will have to get on as early as today, now that you have brought it to my attention. At the hospital, I can tell you immediately. In fact, I got an update via WhatsApp with Dr. B. Israel this morning. All right. So one I can share with you the fact that the TRHA, prior to us coming into office, would have hired an HR firm that did the interviews and scrutinizing for selection of a new CEO of the hospital. And in fact, the Executive Council considered that yesterday. And once certain requirements from the Executive Council are met, then we will go forward with the person that is actually that actually won that interview and was proposed through the HR firm and the TRHA to the executive be hired as the CEO. You are aware that we have an acting CEO, and we are very grateful, very thankful to Mr. Orr, who has worked diligently, be called out of his home more or less to put in all of this effort on our behalf. So we are very grateful to him, but we should be formalizing and fixing the executive structure at the hospital, which is badly needed. We also have had some improvements in terms of the delivery of services at the hospital. We are not there yet, but we are seeing some marked improvements in terms of the wait time that is decreasing for patients, and the number of patients having to just lie around under a tent or sitting around outside all day, that is being remedied. That number is improving. And again, I have to say thank you, special thank you to the staff at the hospital who are going above and beyond to ensure we can meet the demands of the public in a crisis, in a health crisis such as this. And that's why I keep urging Tobagonians to please stay safe. We have 2 more questions before we wrap up. So we have 3 more questions before we wrap up. We have Mr. Clark, Ms. Jackson, and then we will end with Thompson Forbes.
Hi, good morning, Mr. Chief Secretary. Former Secretary of Finance Joel Jack, in responding to concerns you raised about the monthly disbursement of funds to the THA by central government, said that he made that arrangement when he came into office in 2013 and attributed the monthly arrangement to a drop in revenue by the government. And he also said that, well, it's time that the new executive get down to running the THA rather than nitpicking.
Well, that is not nitpicking. The law says we are to receive our disbursement quarterly. When he got into office in 2013, he inherited his office from a PNM colleague. So it is PNM Trinidad and PNM Tobago who decided that they will break the law and give monies monthly as opposed to quarterly. And let me tell you what the implication of that is. When we receive our monies monthly, 1, you can't plan. 2, it means that we have to rely on an overdraft facility that has an enormous interest attached to it in order to fund the operations of the THA until monies arrive. Why are we paying interests for an overdraft facility when we can minimize that if people just follow the law and bring our monies quarterly? That is not nitpicking. That is a crucial matter. And in fact, what is interesting is that I saw this morning on my desk an agenda from a meeting, from a cabinet meeting that was held on Friday, the 16th of November, 2018. Look at when it was held. Friday, the 16th of November, 2018. And I can tell you, item number 3 on that agenda, that meeting held between the Secretary held between the THA and with the cabinet, item number 3 on that agenda was issuance of releases to the THA in accordance with THA Act number 90 of 1996. THA Act number 40 of 1996. issuance of releases to the THA in accordance with THA Act 40 of 1996. That was agenda item number 3. So if in 2018, on an agenda for a meeting with Cabinet, the then THA, of which Mr. Jack was Secretary of Finance, raised that as an issue, clearly it's not nitpicking. Clearly it is a serious issue. So it is disingenuous for him to say now that we should just ignore that issue. In fact, I don't understand what their goal is. Clearly they have not learned from the recently held election. And clearly they have not learned that untruths and propaganda type campaign does not work with Tobagonians. We are intelligent people. We're not stupid. And so we understand what will happen if we get our monies monthly or late versus if we get them quarterly, when we can plan properly, when we can allocate properly, and when we can avoid having to use an overdraft facility that racks up significant interest that we have to pay that is not budgeted for from the subventions from Trinidad. So I don't need to say more on that. Penultimately, Ms. Jackson, and then finally, Mrs. Thompson-Forbes.
Good morning again, Chief Secretary. My question to you is in regards to the tourism sector. Even though beaches are open, the tour guides and so on, reef tour operators are being told that they are not able, they don't have permission to ply their trade. Is there any intervention that the THA can make on their behalf to, help them get back into business?
No doubt. In fact, I had executive council yesterday. It wasn't brought to my attention that they were unable to ply their trade. In fact, I saw news reports where some of those in the tourism sector, the reef boat operators, in fact, I saw a story quoting the owner of Frankie's stores, literally saying that, they're grateful that the beaches are open and now that they can be able to make some monies. I saw a news article to the contrary to that. So I will investigate it. If that is the case, there's absolutely no doubt that an intervention will be staged on their behalf. So I will have the Secretary of Tourism look into it immediately, because what we saw in the public domain is vastly different from what you are describing now. Mrs. Thompson-Forbes?
Good morning, Chief. Are you all hearing me?
Yes, I'm hearing you.
Okay, good morning again. My apologies if I may ask a question that you may have spoken of before. I joined a bit late.
Sure.
A few minutes ago, the Secretary of Health, Dr. Faith B. Israel, announced that a refrigerated container would be acquired by the TRHA in order to house the excess amount of bodies due to the pileup at the mortuary. Can you tell us if you have any idea of the cost and the proposed capacity of this refrigerated container? My second question, we know the issues of the Mauritanian bodies at the mortuary, 15 of them to be exact. Are they still being housed there? And can you indicate if there are plans to discard of them, because I believe that these bodies are taking up space. And finally, there are issues and the situations where wrong bodies are being buried in Tobago due to the amount of bodies at the mortuary. What strategies would be deployed to alleviate this? And I'm also hearing of intended legal action. Is the THA prepared for these legal consequences coming out of these actions? Thank you.
So let me start with the last question first. Number one, no wrong body was buried. A wrong body was almost buried, but no wrong body was buried. And we have been in constant conversation with the family. The matter was rectified. In fact, I spoke about it earlier, and I did apologize to the family again earlier about the matter, but the matter was rectified quite speedily, and systems have been put in place to avoid that. And I did make the point that workers are just really burnt out and tired. The workers have been going over and over. I have met workers who worked 24-hour shifts, went home, spent 2 hours to sleep and returned to work. That cannot be the most productive employee. And that's why I'm begging Tobagonians, don't get sick to go up there. Ensure you take care of your health, and that includes being COVID safe. So that matter with the family was peacefully rectified. The matter with the bodies that need to be disposed of, yes, that I agree with you. That is something that we're trying to get done now, clearing all the legal hurdles to get it done, because there are legal hurdles in getting it done. We couldn't just get up and bury the bodies. That required police signing off. It requires ensuring that we dot all I's and cross all T's. The bodies don't belong to Trinidad and Tobago. That's another issue that we had to deal with. And so, yes, we're working speedily to resolving that matter. And yes, we are at the point where we may just have to move ahead and dispose of the bodies if it is we find the relevant agencies to be unresponsive. Then you ask a question about the refrigeration. I dealt with that earlier. The container can hold 45 bodies. I do not have the cost on me at the moment, but I'm giving you permission to just reach out to Dr. Faith. In fact, she's far easier to get on to than I am these days. So just reach out to Dr. Faith and she will give you the attending costs. But I don't have the cost, the exact figure on me at the moment, but it can hold up to 45 bodies. All right, so members of the media, it's now 10 a.m. and I do have a flight to catch, as I indicated. Ms. Douglas, one question quickly, please. Let's go quickly. Yeah.
Very quickly. The lifeguards, they are complaining. They said even during the time of the former chief secretary, they raised various issues about their payments, their overtime.
Right, correct. So the lifeguards, in fact, this was discussed at Executive Council yesterday. Several of them have received some of their payments, but there are still some who have not received their payments. And the administrator for that division has been in contact with their union, and the administrator, if she has not already done so, will send to the union the list of those who received their payments and those who are still outstanding. So that is in the works. We are also looking at an issue with the lifeguard booth that was built down in Boko, because that was also raised at the Exec Council yesterday. The significant problem with the newly built facility is that the stairway leading down to the beach from the tower is turning in the opposite direction from the beach. And as a rule of thumb, lifeguards have to keep their eye on a victim in the water while they are going to rescue the victim. If they are to use the tower as it is constructed, it means that at some juncture, they'll be running down a stairway with their backs to the possible victim. By the time they get around, it's possible they could lose sight of where the victim is. So that's another issue that we are addressing. In fact, the Secretary of Tourism and the area representative went and did a site visit yesterday and spoke with the supervisor, with the lifeguards and so on. So we are rectifying the issues with the lifeguards as we speak. As we speak, we are doing that. Let me thank you all for listening. Thank you, members of the media. Thank you, Tobago, for joining us. And again, please be safe over the Christmas holidays. Please enjoy the Christmas holidays. You don't need a lot of money. You don't need to have a big party to enjoy it. You could party with your own family inside your house, right? Enjoy it. Find time with your family. Make time for your family. Use this downtime. For the non-essential public servants who will be home between Friday and January the 3rd, spend time at home. It's not a time to get reckless. Please, I beg of you. Let's stay safe and have a good holiday when it comes. See you all sometime next week.